And the mobile noise be brave on my background no emu, but mon fanche me. What it? Mon fanche me. I mean, minya yanke manisa, but ebe anything. Anyway, there is a story be a was me de bremo. Na ahame, and I believe that in this country we need to start saying certain things. We need to start telling ourselves, say, baby, I do as a minor, any quancy as so nyama bisubium. Now, story ne say, you see, pregnant woman be or bapim for be ewu after C-section request allegedly denied due to lack of bed. Wako hospital. Onyem. Seni adi anything. Omosha. Oba no own to me enwo. Right? Own to me nwo sa keke. Inti wasi ye C-section e mano. Wasi ye kano. Yesi ya C-section na mano. Because empa ni ho. Announce am oba na ewu. We are going to go into the story. And then first time we have subscribe and click the notification bell on so. Our latest news be about one Sabeka. Like a video we MIA. Now like here, post be and them the baby ana ebe 12 front page you know so. Corporate logistic assessment control say omobe manage a year cargo truck amount. Say o cargo truck na a year sprinter to 40 feeter. Omobe to me manage amount. Momo bebremo demo cars amamo drivers and nemo wo I was say boss Ezos ate me say Ezos enye mango na kwa akote. I say boss and the engine lock or engine and padlock. Ma corporate logistica and manage car no emma. Omobe maintain car no. Omobe insurance or car no. Ombe tia car bi-weekly. 2 times every single month. Inti frewamo it was 059 8022033. Me boss ubium 059 8022033. Now young concept neso. I say, a pregnant woman in labor has died after the mother and child hospital in Kasoa allegedly denied her request for a cesarean section due to a lack of available beds in its ward. In the hospital no Kasoa, your friend the mother and child hospital. Almost in pain new ho. I said the deceased, Opoku Abigail, according to her sister, had initially visited a private health facility for delivery, but was referred to the mother and child hospital after labor was prolonged. Oko private hospital say oko omo hwe ade ni delay eno moto no ede ne call eye mother and child hospital no. So won ko no nkonko. Or say at the facility, however, requests by both the patient and her relatives for a cesarean section were reportedly declined by hospital staff who cited the absence of an empty bed in the recovery ward. Omudu one omoka say, oh, mumi enye eye cesarean, seni eye opeso opai na akola ne ba. Hospital ne ka say dabi. DNTI yese recovery ward no empa ni ho. The family says Abigail died nearly 36 hours after arriving at the hospital with the baby still in her womb. When to me 36 hours after, her death, which occurred on Sunday, April 26th, adds to what relatives claim are several similar incidents at the facility. Hospital hono ade etaisi no intisi ababeda normal. A sister of the deceased who spoke to City News is calling for a review of the hospital's operations, insisting their relative could have been saved if the request for a surgical intervention had been granted. Also, before she was referred, we were told to allow for a cesarean surgery to save both the baby and the mother. But when we told the nurses at Mother and Child Hospital, they said the recovery ward was fully occupied, so they couldn't perform the surgery. They told us she would deliver, We arrived between 2 and 3 a.m., but they gave her no medication. She was lying in pain. And even when she personally requested the CS, they didn't mind her. Omo call nkuhu say a yaw e duro cry amano. Or katro omo say munye ni CS. They say doctors ni nurses say wo omo mfi ni so ye nipa mpo. Attempts to reach the medical director and administrator of the hospital for a response were unsuccessful, as hospital officials told City News Central Regional correspondent that both were unavailable to comment. It's clearly washa you treat patients, and it is I don't have anything against this. Is the first time I'm even hearing of this hospital's name, but clearly no a typical behavior of what happens in Ghanaian hospitals these days. We don't care about the life of ordinary Ghanaian. Oti ho awo no obi amma mehwe no. Wo ka se yenye ne CS ne kra no. Enfo mo ho omu mfi no. Nebusuafo tre se owo ya mu edro mpo ya ma no obi amma ne ho mpo se wo ba behwe no. You as usual, you know, nipa na waba owu abone ben, that mentality a doctors ni nurses bi mo ababenya e wo Ghana ha se no. Odwen ho awonti ase. So we call teacher training schools no. Teacher training, nursing training schools. Any doctors bibi aye training omu ni na. Obehu ne sa se ade no mo ye ne, they have passion for ade ni bi. Ye ba be form mu adwuma mu pe. Na afei unhu bebi asuban ni free, and it is sad. In today's age, on my way more yetimu and their age, we shouldn't be talking about things like this. Seriously, we shouldn't be talking about things like this. In today's age, any BSN yabase. On my way, you see, on my you will good, you will we. No. What do we see? You shouldn't be talking about things like this. Say, you see, you be CS. You say, you nimpa. And then Muremu Ghana. You see, you nimpa wa hospitals. You call hospital and near that form. Charlie. It's sad. It's sad. Where is a minister? Ebe yes will take action. Pay these same working professionals, 27-year-old. Minister yes will be taking action. Pay these same professionals no be bad saying, and yeah we are declaring strike, and yeah we are doing this. Now so here they are the ordinary Ghanaian. Me see ende se wo yare na we busi ni bi eye nurse ana doctor na wo yare omo ho pre omo ho because omo nim say hospital na ye de wo kɔ no enye omo no mo hwɛ wa nurse na doctor na wo kɔ akɔhwɛ no on hwɛ se ne ebia na nkomo abɛhwɛ. Inti baby aga na babedu sisi ana eje se ebia unya obia investi ema ne busuani bi babeda ne nurse se daachi bi okɔkɔ yare a yanko hospital anko hwɛ no basa ne busuani ni na babehwɛ. How do you even live in a country like this? But that is where we are heading towards, and it is sad. And yet ebusuafo book na eda screen is on your friend the Ghanaian investor. This is your most practical guide. Ebetro senior obe investi ewo Ghana. Now a lot of people don't know, but you will be a friend of the Ghana Stock Exchange. Now Ghana Stock Exchange, you know, we invest ewo Ghana Stock Exchange more. What it simply means, and it's a udi usika invest in some companies be a listed ewo Ghana. Companies be to say a year Ghana Commercial Bank, companies be to say MTN. Into the best investments are any Ghanaian can ever do. Investing in a Ghana Stock Exchange, because on average Ghana Stock Exchange, you know, a return revenue and an ROI of 25%. What it simply means is that every single year biano when you crano na 25% if you invest in a Ghana Stock Exchange. This book is going to go take you through how to invest in a Ghana Stock Exchange, how to invest in a Nyamabia your friend mutual funds. Now aside this, no, there are 3 other investment firms be a Ghana hands on so a yes secret and microphone. If you purchase this book, you are going to get to know of those secrets or those investments, and then it's going to change your life forever. Get this book, The Ghanaian Investor. So open book maybe at a very simple number na that book ne so 055-807-4986. Obe to me a fresh number no. Ofra you best sort out with the book. Obe to me so our WhatsApp number no. So one person obe free and answer one person obe WhatsApp ya. Very simple. On your screen, video na wo hwe sisia no obe hu baby ya draw view products. Obe to me a click so a obe hu say books ni na ebeba. Na wa click book no o version ni twi video wo ho. Ni PDF ewo ho, ni English video enso wo ho. Twi video no eye for wo mo a eye na akenkan eye omoden. Omo ana wo ntumi nkenkan brofo. Ni English video enso wo ho, akenkan ye oden na nso pe brofo a English video wo ho. PDF enso obi a wo hwe a wo pese wo kan wo phone so na trese bibia eco smooth no. Also there any the PDF. So that is also another way you can get the book. So what me now you Ghana ni now our brochure. You can just go on Amazon. Now I search book no the title. That screen is no The Ghanaian Investor. Into search for book ne title Ghanaian Investor. Obon say beba na wa purchase na say ya ship e dia bro e wa brochure ho. And I say video na wo hwe sisia no ye wo be a friend the description box e wo YouTube. Into your answer obe click more. O click more obe call description box ni mu. Into call description box ni mu a obe hu say eye book no ne links ewa ha what ya say o pese o use mobile money a eno ne say wa click sa link na ya tro get my book here for mobile money, get the ebook here na wa click so na unsaka get the hard copy na wa click so na unsaka very 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 simple. These are the ways obetumi use enya book we yento book we ni ehu senia yebetumi invest. Ghana's economy is booming. I personally believe that the next set of billionaires and millionaires, no, they will be coming from the Ghana Stock Exchange. And so take advantage of this, learn how to invest in the Ghana Stock Exchange amidst any other and all other investments, and also what Ghana for.